Let's start by understanding what noisy breathing actually means. For many babies, especially newborns, noisy breathing can be completely normal. Their airways are tiny and still developing, which can cause sounds like snoring, gurgling, or even wheezing. This is more often noticeable when they are lying down or after feeding. In medical terms, these sounds can be caused by mucus or milk in their throat, or even just the air moving through small sensitive airways. So what are the common causes of noisy breathing? Most of the time it's due to something harmless like mucus buildup. Babies are born with some mucus and they can't clear it like adults do. Or nasal congestion. Babies are obligate nose breathers, which means they prefer breathing through their noses. And even a little congestion can make breathing sound noisy. Number 3. Laryngomalacia. This is a fancy term for a soft, floppy airway. It's a common cause of noisy breathing and usually resolves on its own as the baby grows. These conditions typically don't require any treatment and often improve as your baby's airways mature. Now coming to the serious causes. While most causes of noisy breathing are harmless, there are a few more serious conditions which we need to keep in mind. Number 1 is croup. This is a viral infection that can cause a loud barking cough along with noisy breathing, especially at night. Number 2, bronchiolitis. Another viral infection that can make your baby's breathing sound wheezy and difficult. It often comes with fever and a bad cough. Number 3 is congenital airway issues. In some rare cases, a baby might be born with a problem in their airways which can make breathing noisy. This requires medical attention. So now, coming to the main point. When do we worry if your child has noisy breathing? Here are the key warning signs that you need to watch out for if your child has noisy breathing. Number 1, struggling to breathe. If your baby's chest is sucking in with each breath, that's called a retraction and that's a red flag. Number 2 is cyanosis. If their lips or skin turn blue, seek medical help immediately. Number 3, wheezing. If the noisy breathing is accompanied by wheezing and your baby is having trouble feeding or is unusually sleepy, it's time to see the doctor. And number 4 is fast breathing. If your baby is breathing faster than 60 breaths per minute, it's a sign that they could be breathless and struggling to get enough air. So please seek medical attention immediately. Most of the time, noisy breathing in babies is more stressful for parents than the babies themselves. Remember, their little airways are still developing and most of these sounds will disappear as they grow. But if you feel something is off, trust your instinct. You know your baby best and reaching out to your doctor is never a bad idea. Thanks for watching and be sure to subscribe for more tips on keeping your baby healthy and happy. Till then, stay safe. Thank you.